Hello, my name is Paul the Physio, and if you get pain around your kneecap, this video is just for you. So our patella is the bone on the front of our leg, and it is part of our quads mechanism that gives us knee extension. So around it we have a load of gristle and soft tissue that just holds it in place, and very often there's pain in this retinacular material around the knee, or actually directly on the patella tendon just below or just above, and they are great places to get stuck into with a TEND, with its fine point and its super high frequency, low amplitude vibration. It allows you to reach those places that you just can't normally reach. So if we start down here on the tibia, we can scan up through the tendon that joins the shin bone to the kneecap. So our inferior patella tendon is a vertical strip running down through here, and we want to just pop the tend on there and look for any tenderness through that little thick strap that holds the kneecap to the lower leg. If you find some tenderness, very often one end or the other, so either right here where it inserts onto the shin bone, or right up here just as it goes into the kneecap. If you've got some soreness there, then basically we just want to hold the end of the tendon to create some sustained focal vibration, and then think about adding either some active movement of extending the knee or some more passive movement of dragging the leg in and out of a bend position. But by combining the local sensory stimulus of vibration with a bit of gentle movement in the area, we massively increase the therapeutic value of both the soft tissue work that we're doing with the tool and what we'd get from movement. So stacking together a bit of gentle movement with vibration right on the sorest point underneath the kneecap there, really, really useful. So then we can come around, and if you're not sore on that tendon, what you may well have is more retinacular pain. So that is just the flattened out ligament material that actually goes either side of the kneecap. So we've got an inside track that we can clear out, and the head of the focus is particularly great for really kind of exploring all the nooks and crannies that we all have around our knee. And any sensitivity around these structures is a problem. Wherever we find it, we're going to pause, keep the vibration focal to that spot, and add little bits of movement and muscular contraction to what's happening. So we come through the inside like so, and then we want to do the same thing on the outside of the kneecap. So coming around the other edge and just looking around it. I can use the other hand to move the kneecap slightly to make it easy to get the tend right where I want it. Choose a vibration level which is interesting and stimulating, but stop short of blooming painful, right? We want to feel it to heal it, but it isn't simply a case that no pain is no gain. So we've made it around the kneecap from either side, and we've come up through this little tendon underneath. So the other place that a lot of people will have soreness is around the superior patella tendon, so what joins the actual muscle of the quadriceps onto the kneecap itself. And that's again a great place to come in and fish around and look for any sore spots and tenderness that you feel through there. And then just again working on those spots and adding gentle amounts of movement, of actively extending the leg or more passively dragging the knee up into flexion, keeping the tend on sore spots the whole time. So those kind of nice focal movements are really good. And then I can also just scan around, and don't forget to come directly over the top of the kneecap. For some people that will actually be sensitive through there. And the tend's best trick really is to help you find the bits that are sensitive and then reduce that sensitivity with the very same vibration that found them. So treating around your kneecap like this can be a really fast ticket to pain relief, often going to be more effective than ice or heat or the general kind of massage of the area. It allows you to be 10 times more specific than you can ever be with a conventional massage gun. So tend around the gristle of the kneecap and following that inferior patella tendon, patella retinaculum, and then the superior tendon. Really good idea to check out all those spots. Now, if you've done that and it's feeling nice, now's the time to do some exercises that are good for it. Two things that we can confidently say almost everybody with a sore kneecap needs to do: stretch out their quadricep muscle a little bit and find some ways to strengthen those muscles really focally. So stretching it first of all. If I say do a quad stretch, most people will do this. It's not a total waste of time, but it's not a great stretch by any means. Much nicer is to come down into this half kneeling position. I want this gap to be as long as my thigh bone is up here. So foot's not back here, it's out there. From there, I'm going to go opposite hand on the floor, opposite hand grabs the leg at the back. And then in this position, all I've got to do is rest my shoulder on my knee at the front and then move my head and shoulders forward so that that back hip drops into extension, and now I get a much fuller stretch on the whole quadricep muscle. Once I'm into that position, I can then look round over one shoulder and drag the foot in the opposite direction, and then do the same thing going the other way. And as I make this twisting movement all the time, committed to that forward hip extension position, I'm able to send a really meaningful ripple of stretching input through that whole volume of quadriceps muscle. Too often people end up just stretching one bit over and over again, or using stretch positions that just don't allow them to really target the bit that needs the stretch. So give this quad stretch a go before you tell yourself that your quad length is absolutely fine. Both legs should feel about the same. No guarantee your sore leg will be the tighter one. So we stretch quads, and then we want to strengthen quads. Now, there's lots of good options for strengthening quads, but a particular favorite of mine, because it allows you to really target the quads and it allows you to do it without any kind of gym equipment or weight. So all I'm doing is I'm kneeling. Easy foot position is like this, hard foot position is like this, and then from there I'm going to do a reverse Nordic. So that is to lean my body back and recover it using my quads and my abs. My aim is to keep my hips and my back completely straight. So before I go, I check my legs are parallel, I switch my bum on and I switch my guts on, and I imagine that I have no ability to move my hip joints or my spine. From there, I'm going to lean backwards until I feel some strain in these muscles, pause for a couple of seconds, and then recover back to upright again. And then basically I just learn to go further back into that movement, watching out for breaking of this nice straight line. So the two errors that we'll see are arching, where you feel a compression in your back and your shoulders went back further than your hips. And then we'll also see sort of sitting back faults, where you can only go so far and have to sit down before you come back up again. Stick to the range that you can go down like you came up. When you're getting comfortable with it, with your feet in this position, flip your feet the other way. Now your calf muscles can't help you and you've got more range to fall into. So as we get better, we can look to achieve full range of motion through that exercise, all the way down to trying to get contact between your heels and your backside without ever losing that nice straight line through the body. So reverse Nordics are an awesome way to get some strength into quads. This is the way you should be stretching, not the standing version, and Tend might be your absolute favorite tool for working out all those sore bits within the gristly soft tissue of your knee joint.